Welcome, everyone. I am Adam Kalunga, founder of the Truth and Accountability Project, and this is Insight Politics. We have a very special guest today. She is from our home state of Arizona. She represents Arizona's 7th Congressional District. Without any further ado, let's go ahead and welcome her to the show, Representative Adelita Grijalva. Welcome, everyone. Today we have with us Representative Adelita Grijalva from Arizona's 7th Congressional District. Thank you very much for joining us today.
Thanks for having me.
All right, I'll just get into it straight away. One of the things I really wanted to talk about was the detention facilities. So, you represent um, a border district, and we've been hearing a lot of basically horror stories about the conditions about at some of these facilities. And I think it was last week on the 7th, you conducted an oversight visit at the Florence holding facility. Can you talk a
Correct.
little bit about that and what you saw there?
So the Florence facility is made up of five different sort of building structure systems, and they call it like the whole thing is Florence.
Hmm.
So what we were getting calls about in our office is people that were there's a staging sort of processing initial place that
Hmm.
people are taken to, and it's only supposed to be 72 hours.
Right.
People were telling me that they've been there for longer than, going up on 2 weeks, some over that. So I wanted to see that specifically. And because it was not a scheduled sort of visit,
Hmm.
they ask specific, what do you want to see? And they will only take me to what I ask for. So what I'm asking people now is like, tell me the other names for the other buildings so I can ask for that too, because I'm not getting a lot of cooperation in like, hey, so where does this happen? They'll just look at me like they don't know what I'm talking about. So one of the locations was it's either conos or coños, depending on who you talk to.
Hmm.
And that's the space that I want to see, and I don't think I saw. I think I saw one of the areas, but not that specific one.
Okay. And which areas were you able to see?
They took me specifically to a staging processing
So
location.
not like the
So,
holding areas where they've been keeping people for multiple
um,
weeks?
yeah, I mean, they're saying that this is only 72 hours. The two locations that I saw, like two rooms that I saw, were
Hmm.
like sort of day rooms in a jail, if you I can describe them that way. There's
Hmm.
a lot of people in one space. They said that there were bunks around the corner. I couldn't see those. I could see to the left phones and then chairs for people to sit at, but I don't know. I didn't see medical facilities. I think there were like maybe a shower, but it's all glossed up so you can't really tell. And the point is that, these are not spaces that people are supposed to be detained for long periods of time because they don't have like the infrastructure supports to be a
Right.
place where people can stay. And so that was kind of what I wanted to see. I was shown exactly what I asked for, and then walked away. But they made references to other locations, like where I was, were only men. So where are the women?
Right.
They're like, oh, they're in a neighboring facility. Okay, where's that?
Yeah.
Well, you'll have to come back another day. And their argument is, we're showing up, they're not prepared for like a tour, which I understand, but I do think that these um unannounced visits are critically important when what we're hearing is that when they know members of Congress are coming, they clean everything up. Some
Right.
people are moved out, overcrowding situations are addressed. When we just show up like we did in Mesa here at A-Rock, that facility,
Hmm.
it's scary how many people they shove into one space.
And what was that facility like?
That one is another processing. Apparently, that is one where people are leaving, being deported.
Hmm.
But when I asked real specific details, they said, well, it varies, person to person, story to story. But there was a location there that had on the top of it said max capacity 21, and there were 47 people in there.
So it's like
So
that's more
there's
than double.
you literally, they're like sardines. Like, if I asked everyone to sit down, they could not sit down and not be sitting on top of each other.
Wow. That
Yeah.
sounds horrible. And I know there are multiple lawsuits going on right now with I think Amnesty International and the ACLU. have lawsuits in progress for some of the conditions that we've seen in these facilities. Just absolutely horrible. And so
They're
I know the
they're
Florence,
inhumane.
yeah.
Inhumane is where I say. And then the other thing I asked about is like, so there's one room that had more people than others. I said, where, do you try to balance them out? Or, well, some people might be in the dining hall, and then literally, like, you couldn't time it better. Someone rolls in with food and styrofoam containers. Well, this is how they eat all the time. Would you like to see? I'm like, sure.
Sure.
But I don't,
Yeah.
considering the stories that we've heard and the fact that
Yeah.
there is not enough food and people steal food, this is by no means do I think that this is something that happens on a regular basis.
Right. And I completely agree with that. I mean, the administration for so long has been trying to curb these visits with the 7 day notice and all of that. So it's
Mhm.
obvious they don't want people to see what's going into that. And it's obvious they're not putting the money necessary into these facilities to properly take care of the amount of people that they have in them. It's just horrible, the things
Right.
that we've heard, especially with overcrowding, lack of medical care, lack of clean drinking water. Uh,
Lack of food, any nutritious food is making kids sick.
yeah.
That was another thing. I went to Dilley with Representative Castro and saw that facility in Texas,
Hmm.
and just this last week. And when we got to the dining hall, there was a spread. They had like roasted chicken and roasted potatoes, fried shrimp, a salad bar, cut up watermelon, and they had a menu that was like electronic. So it was in
Yeah.
English and Spanish. And I said, this is not the way they eat every day. There's
Yeah.
no way. And they can eat as much as they want. Like, so if that were the case, people wouldn't be losing weight. Like these
Yeah.
kids wouldn't be like, starving because the food was so horrible. That I know that that's not what happens, or
Yeah.
that this is an open campus and people can walk around as they want. And then when we're walking around, there's not literally a soul.
A
Or
person
we go
out.
into the medical, right? We go into the
Right.
medical area and it is literally sterile, pristine. I'm like, I know I've been in schools my whole life. I was
Right.
on a school board for 20 years. The smallest elementary schools have a line of little people.
Hmm.
Something is always going on. So you're trying to tell me that nobody in the 400 people that are here need any kind of medical assistance? It's just, to me, you just have to follow the money. That's
Yeah.
what's happening here. It is that facility in Delhi gets 15 million flat a month, regardless of how many people are in that facility.
And that's
The
a privately
capacity of
run facility?
2,400. Dilley in
Is it a
Texas.
privately run?
Yeah, yes.
Yes.
Yeah, it's
Because I know
privately run.
Florence
They
is
have
a
ice. Yeah.
federal facility, so there's not really any difference between the federal facilities and the privately run facilities, just as bad.
N- Nah, they're pretty bad. They're all, I mean, they just put as many people into an area as they can in order to minimize the staff that has to sort of supervise.
Yeah. All right. So speaking of funding, I know you guys in Congress have been putting up a good fight to stop this 70 billion on top of the 140 or 175 that ICE already has in DHS. But it looks like Republicans are going to get that through reconciliation. But how can that money be better spent? What are the types of
Oh.
things that you guys have been fighting for, to use that 70 billion in a way that better benefits, your constituents and the people of the United States?
Oh my gosh, we could have people could have healthcare for a year for free.
Yeah.
Millions of people, 25 million if we did the numbers right. We could have all day early childhood education for thousands of, I mean, like it was like 1.5 million children. We could help people with affordability issues. When you break down the
Hmm.
dollar amount per person in Delhi
Hmm.
that they get per month to house and abuse people there, $37,500 per person.
Per
Can you
month.
think per
That
month?
is, and what is like the average SNAP benefit is like $6 or $8 a day. Like that
Correct.
money could be spent feeding millions of Americans.
Millions of people. Wraparound services that they also cut from SSI end
Hmm.
up being like $1.25 a day. Think about like what we could actually be doing. And these are people that are citizens that are
Yeah.
struggling. There are veterans, there are seniors, there are
Oh.
children,
Hmm.
people with disabilities. I mean, these are not people that, when they talk about, well, people should work for what they have. They're literally
Yeah,
incapable of working. There are people that need our supports, and this administration is choosing to turn their back on everyone that actually really, really needs help and are happy to give handouts, not only to their billionaire buddies, but also to other Trumps. I mean, come on.
yeah,
I mean, when these sons are getting contracts
yeah.
that they're the only person that put in for this one contract,
Hmm.
$680 billion. I mean, come on. It is so corrupt.
It's
And I
so
think
blatant too. It's
right, I think that that's part of the thing that pisses me off the most is that when you have people saying, well, it can't be illegal because it's just out in public. You're like,
they don't
no,
care
it's
anymore.
absolutely not. They don't care anymore, right?
They
They
don't
don't
care
care.
at all.
Yeah, I
Wow.
agree.
Okay. Another thing I wanted to ask you, with you being a representative from a border district, last year, Attorney General Chris Mays put out a notice, and I think they published an article on AZ Central as well, that federal drug prosecutions, and money laundering prosecutions are down in Arizona. And she put in a request, I think, for extra DEA agents. And at the time,
Right.
the Attorney General Pam Bondi and the Trump administration denied that request.
Yeah. Yep. I mean, I'm glad you're pointing out that Trump is taking resources away from our borders to
Right,
terrorize communities in the interior of our country. And the vast majority of drugs flow into the US, come through our ports of entry. So
right.
if Trump was actually serious about cracking down on smuggling, he'd be investing in our ports of entry, modernizing our ports of entry, not taking CBP workers from our border, like the ports of entry into communities like Minnesota.
Minnesota,
So,
Chicago.
yeah, so they're prioritizing, resources and going after people like our abuelas, nanas, tatas, grandparents,
And
children, people with
yeah.
no criminal history. And this has never ever been about keeping our community safe. This does not make our community safer. It just
Mhm.
sows fear and takes away resources from people that actually need it and where the resources are needed.
Exactly. Because I think what Attorney General Mays was saying also, that 90% of the fentanyl that comes into the United States comes over our land borders.
Yep.
So while they're spending millions striking fishing boats in the Caribbean, and they're
Yeah.
taking away resources from our physical borders, mostly in southern Arizona, southern Texas, where these major drug routes are, it's the money they're spending isn't having an effect on the actual inflow of drugs like fentanyl into the United States.
Mhm.
Yet they're taking these resources and basically locking up people with, like you said, no criminal histories.
None.
And they talk about waste, fraud, and abuse. Like that seems like a serious misuse of, our allocation of resources.
Yep. And you know what drives me crazy about this whole argument that is so anti-immigrant? I mean, it was clear from the first Trump 1.0 that he
Yeah.
had to find a group to target. He had to find a group to be the scapegoat. And he put it clearly on, like flatly on the backs of immigrants.
Hmm.
But what he's not understanding is that if what the rhetoric says were true, and we just get all of these people out that are taking all of our resources, that it'll be better for all of you Americans that are here, all of you citizens that are here.
Hmm.
Is our economy better? Absolutely not.
No.
No, and the United States has always relied on immigrant labor. My
Oh.
tata was a bracero, have always relied on immigrant labor
Hmm.
to lift up this country. And now what he wants to do is not give a clear pathway to legalization for anybody, including DACA students, including people who have lived in this country for over 2 decades.
Yeah.
So I had this argument with the woman who said, if, people would just do it the right way, the way her family did. I said, I mean, I know. I was like, don't roll your eyes,
Right.
Adelita. This is what I'm going to do is I'm going to say, talk to me about when that happened.
Yeah.
And do you think the right way is asking for asylum at the border, asking for like temporary,
Yeah.
work visas, asking for, I mean, DACA students that have been here their whole lives know no other country but this one. Do you think that that's fair? Well, that's not who he's he's deporting 340. And then this was last week, so it's probably higher now.
Hmm.
340 DACA recipients have been picked up by ICE. 70 were
340?
deported. 70 have already been deported because
Wow.
once you are in the system
Oh yeah,
and
they
you
they want
feel
you
like
out.
they make it so horrible for you that they're like, take this money. I'm
Hmm.
going to give you $2,500, where we can't actually verify that anyone actually receives that money, by the way.
That's
But
another
let
thing.
me go ahead and incentivize, or we'll just make it miserable for you while
Hmm.
you're here until you self-deport.
And that's the one thing that we've heard the most stories about is just the horrible conditions, the lies, the literally brutality to get people to self-deport. I mean, I've
Yeah,
heard so many stories, I read so many stories about young men and women who just say, I can't take it anymore. Like they're mentally, physically draining these people to get them to leave when they have a legal right to be here.
absolutely do.
But the,
Yep. I talked to a mom in Dilley, and she has an 8-month-old that is in ICU in Corpus.
Mhm.
Pediatric ICU in Corpus, and she can't consistently get information about her baby. She's
That's
a
bad.
nursing mom, and that's another group that is coming up more often.
Hmm.
People who are nursing. And as a woman who nursed 3 babies,
Hmm.
like those infections, when you have a clogged duct, those are life-threatening,
Oh
and they're
yeah.
not getting support. They're like, well, and the cruelty, the dehumanization
Hmm.
starts with the people that work there. When I did the tour, they're like, well, these aliens. I'm like, they're people.
Yeah.
And I don't know how you describe people when you are with your buddies or whoever, but with me, this is my tour.
Hmm.
Don't dehumanize people. You can say undocumented, you can point, I can see who you're talking about,
Yeah.
but don't say aliens, but there are no aliens here.
No. And yeah, it really starts from the top. I mean, we've seen it
Yeah.
now with the former ICE commander Greg Bovino now that even though he's out, he's now doing the white nationalist influencer circuit, popping up on all these podcasts
Yeah.
and the things coming out of his mouth. And that's who was in charge of this whole program. And now that he's out, he's revealing who he really is, and it's disgusting.
It is disgusting. And that's the thing that I feel like we have to hammer home with my colleagues,
Hmm.
with leadership, is that there have to be legal consequences to what has happened in this country. We cannot just
Absolutely.
say, well, that was a different administration and we're moving on. No,
No,
no, I
no.
cannot move on and look at people in the eye and not fight to make sure that those people who committed atrocities against other human beings have consequences. And I don't want ICE to exist at all. There's no way to repair a
Oh, yeah.
system that is this broken and this
Mhm.
corrupt. No way.
Yeah. I think you're absolutely right. It's beyond repair.
Yep. And everyone that's working there should not have a job.
Oh yeah.
Because if you can take illegal orders,
Hmm.
you can treat people the way they're being treated there, that
Hmm.
you should not be working anywhere near other humans.
Exactly. It's
Yeah.
horrible. Just, I mean, the constitutional violations, the civil rights violations, it's terrible. All right. So, Trump and the Republican Party have slashed about $1 trillion from healthcare funding. So
Mhm.
I read an article recently that you just joined, Protect Our Care Arizona, I believe is the name of the organization. Can you tell me a little bit about that and what you guys are
Well,
working to achieve?
I mean, really what we're dealing with is 1 trillion being cut from Medicaid and the Affordable Care Act.
Hmm.
And so what we're trying to do is, one, highlight the stories of people that are struggling without health care, what that means for us, and that Arizona took the biggest cut to Medicaid. 400,000 Arizonans are off the
Wow.
Medicaid rolls, right?
Yeah.
180,000 kids. And so for me, we have to reverse the devastating cuts from the big ugly law, but
Terrible
also
bill.
it's horrible. But also, like, we have to reinforce these systems, because I do believe very strongly that when there's a pushback of like we shouldn't be paying for ACA premiums because those only go to the billionaire healthcare, conglomerate, whatever. I don't have an argument there. Let's do single payer then.
Yeah.
Right?
Let's
Right.
take care of it.
Universal health care. I'm all for that.
Why
And
not?
then it's like, well, no, not that far. No, no,
No.
no. Let's get there, because part of the problem is these ideas that we have that I think were at one time called like socialist and they never were communist country, blah, blah, blah.
Hmm.
Where we are now is people who are in medical debt
Hmm.
for the rest of their lives because they got sick. You know, people are struggling. There are a lot of jobs that do not offer health care,
Yeah.
especially those that are profiting the most from this administration.
Hmm.
Walmart, look at the people that are accessing like, you know, health
Yeah.
care that are
Yeah.
that's federally or state funded. They're
Hmm.
people that have jobs in a lot of these businesses where their CEOs are taking bank home. And we have to change that.
Yeah.
We do. And I think that we have to do like, and the other thing that Trump did is they cut a lot of money to NIH. So the, you know, medical research
Hmm.
funding,
Oh yeah.
critical programs, all of that support disease prevention. I mean, when I heard that story that, well, there's this, you know, disease that could be is floating around somewhere. I'm like, oh my gosh,
Hmm.
we can't survive that as a country right now because he's
Oh,
cut everything.
it would be
Everything.
devastating.
Yep,
Yeah, the
exactly.
cuts to NIH, to cancer research, to the CDC, combined with cuts to healthcare. Like if another pandemic were to happen, if another COVID were to happen, we would be way
Completely.
unprepared.
Yep.
Yeah.
And then, you know, I think we just have to acknowledge that Medicaid is the largest health insurance provider in this country,
Mm.
covers 68 million Americans. So here in Arizona, it is a lifeline to 1.5 million people. And that's like children, seniors in
I
nursing
was gonna
homes,
say it's
you
mostly
know, families.
seniors, children, it's the people
Yep.
that need it.
Yep.
And they're cutting it
Exactly.
from the people that need it. I mean, I think this narrative that there's millions of people on these programs that don't deserve it or don't need it or they're just sucking money from the system, it's I mean, it's a false narrative.
It
I mean,
is.
these
Yep.
programs exist for the most vulnerable people. And when you make these massive cuts to them, it's the most vulnerable that are affected.
Absolutely. And then you have to look at the ripple effects. Like when you cut Medicaid and
Hmm.
people don't have health insurance, you also gut our hospitals. And
Right.
our rural communities are feeling the pinch more than anyone else because they'll be the first ones to let you know this is not going well. So
Yeah.
in my district, places like Nogales and
Hmm.
Bisbee, it's a matter of survival to have that rural health network and hospitals and clinics available. So
Yeah.
like rural hospitals rely on Medicaid to keep their doors open. So
Hmm.
when we cut those programs, you're also cutting a lifeline to whole communities for health
Entire
care and
communities.
access.
It could be the only hospital within an hour's drive. And
Right.
now,
And yep. And think about the people that have chemo that are, you know, have cancer and are doing chemo treatments, you know,
hmm,
2 or 3 times
all
a
right,
week.
dialysis patients.
Right?
Yeah.
If you live in Nogales,
Hmm.
you're supposed to drive to Tucson.
Yeah.
Right? I mean, can you, and some people, and look at the price of gas. I mean, it's just like we are cutting like critical healthcare services and lifelines to so many people. And we can't allow it to go on without calling it out and putting in legislation that's going to roll it back.
Yeah. And that's why this November is so important. I've been saying
Really
it
is.
for, I mean, the last 13 months. This
Yeah.
November 3rd could be the most important or most consequential election of our generation. Like, we
Yep.
have to
It
take
really,
back the Congress. We have to.
we have to take back Congress. And then when we get it, we have to do something with the gavel.
Oh,
Because
absolutely.
if we don't, we will lose the White House because we're sitting around fighting with each other. There is much that we agree on,
Hmm.
regardless of where you fall on like the ideological, you know, spectrum, whether you're more progressive like
This is,
me or someone that's more moderate. Like Democrats stuck together almost 100% of us when it came to like demanding reforms for ICE and CBP.
hmm,
We did. We also stuck together very closely when it came to the ACA premiums. So there's
yeah.
clearly places where we have to roll back some of what has the cuts that have happened, but we also have to look at the system and how it was a little too easy to break up because there's enough criticism
Yeah.
of the way the system was.
Hmm.
So we have to, as to take a term from um, Biden, we have to build back better. We can't just take it back to where it was. It has to be
Absolutely.
better. Yeah.
That's great. All right. Well, thank you very much. I really appreciate you joining me today, and hopefully we can talk again soon sometime.
Yep. Anytime.
All right. Thank you
Thanks.
so much.
Absolutely.
Wow. That was some great insight from Representative Grijalva. Once again, I would just like to thank her for coming on to the show. But you guys heard it straight from the source. The atrocities being committed by Donald Trump, Stephen Miller, and this administration are absolutely horrible. The conditions in these ICE detention facilities, the lack of oversight, the lack of accountability, it's just absolutely terrible. I mean, what it all breaks down to is they are basically committing crimes against humanity. All right, these are dehumanizing conditions, filthy conditions that nobody should be forced to live in. And some of the stories we've heard coming out of these detention facilities, um, there's no other word for it but the torture, the physical abuse, the mental abuse. I mean, we are barely 5 months into the year, 4 months into the year, and we have already had almost double the amount of deaths in these detention facilities that we see in an average year. And last year we had over 30. I think the final count was 36 or 38 for 2025. That's not normal, people. That speaks to abuse. And this Republican administration is not only not doing anything about it, they are encouraging it. I think that's the bottom line. They are absolutely encouraging this type of behavior from these private prison facilities and the federal facilities. As you heard Representative Grijalva say, there's no difference across the board. And this is millions, millions of our tax dollars a month are going to fund basically torture camps. It's disgusting. It's absolutely disgusting. And that's just one of the reasons why this November's midterms are so important. If you want to live in a country where people are treated with basic human dignity, we have to win this election. We have to take back the House. We have to take back the Senate. We have to provide accountability and oversight. And more importantly, I mean, I totally 100% agree with what Representative Grijalva said. We can't just wipe it under the rug. We can't just say that was the past. We're a new administration now. That's not going to happen anymore. There has to be accountability. People like Stephen Miller have to face accountability. People like Greg Bavino, people like Jonathan Ross have to face accountability. And it's not going to happen with Republicans in control of government. On top of that abuse, you have the devastating cuts to Medicaid. On top of that abuse, you have the devastating cuts to Medicaid and public health services that we spoke about, and these have a ripple down effect. You know, it's not just the seniors and the children, it's the closure of rural hospitals. It's taking away access to health care from not just people on Medicaid. And that's the thing. These Republicans say, oh, there's waste, fraud, and abuse. First of all, there is little waste, fraud, and abuse. But when you have these massive cuts, these trillion-dollar cuts, and it forces the closure of maybe the one rural hospital that's within an hour of your home, and even that's too far to drive for a hospital, that affects everyone else. They're they're inhumane. They're inhumane decisions that Republicans in Congress and the Trump administration are making. And for what? And for what? Last year, they added $2.2 trillion to the deficit. They're not saving any money. They're not saving any money. They're running up the deficit. Our total national debt is now greater than our nation's GDP. Interest payments are over $1 trillion, greater than the defense budget of this country. So what are these cuts doing? Who are they helping? They're not helping anybody. They are devastating public health in this country, and they are not helping anybody. They are not saving a dollar. It's not only incompetent leadership, it's cruel leadership. And once again, that's why November 3rd, 2026 could be one of the most consequential dates in American history. If we don't take back the House and the Senate and put us on a path to victory in 2028, I I shudder to think of what the future of America looks like under 2 more years of the Trump administration. That's all I got to say for today. Thanks for watching. Like, subscribe, follow us if you want to hear the truth. I'll talk to you guys next time.